for the restaurants and cafes and for the other businesses which are reopening. So step by step, sticking together, we will get through this, but there's considerable risk yet to go. The second matter I'll deal with is yesterday the government made a mental health announcement in relation to COVID-19 and the transition out of it. Of course, any mental health announcement like that is a welcome one. However, the Australian Psychological Association, Headspace and many others have pointed out that a fair dinkum announcement would involve extending the number of free Medicare consultations from 10 to 20, at least as a temporary measure, as the government did in relation to bushfires and as Labor has previously suggested. So I welcome the announcement in relation to mental health, but I would call on the government to continue to work with mental health professionals and consider extending the Medicare mental health plans from 10 consultations to 20, as so many experts have pointed out is so necessary. We've had 600,000 Australians lose their jobs. The mental health impact of this crisis has a long way to go, and for many people, 10 consultations simply won't be enough. The final point I'll make before answering questions is that we started to see the elective surgery restrictions being lifted, and again, of course, that's very welcome. Included in elective surgery is dental work. Now, what is very necessary is the government to renew the National Partnership Agreement with the states in relation to dental for our most vulnerable Australians. This runs out on the 30th of June this year. This will be just 6 weeks away. The government needs to fix this so that from the 1st of July onwards, those Australians who rely on public dental can continue to access public dental. We already have very big waiting lists for public dental. We already have huge delays for people to get their teeth fixed. We already have thousands and thousands, up to 70,000, avoidable hospitalisations because people haven't been to the dentist. We already have 2 million Australians delaying or avoiding dental care because they can't afford it. We can't afford to put more pressure on the dental system coming out of this crisis. It's urgent that Greg Hunt and the federal government negotiate with the states a new national partnership agreement on public dental and get it implemented from the 1st of July onwards. We'll continue to call for that. We'll continue to hold the government to account. Australians deserve world-class, first-class public dental. They won't have it, and they certainly won't have it without a national partnership agreement.